But not having health insurance is, it's like you're suffering.
When I had insurance, I was able to treat my chronic conditions. I was able to go to counseling, be on my medication for my depression. So not having my medicine for that has made it really hard just to get through everyday life.
It could be middle class people who, lose their job. You never know, so don't just assume that it's, for poor people.
Well, I had a job and got laid off, and if you don't have the copay, then you can't pay. It was terrible because I couldn't get my need met. So if I go to work or whatever and I'm not in good health, how can they work?
To go from having it to not having it, you don't realize really what others go through until you don't. There are a lot of us out here. And everybody who's going through this aren't people who are lazy, aren't people who are not striving, aren't people who are not doing the best they can to find employment.
And in the rural setting specifically, we have a lot of younger grandparents, and by that I mean like in their late 40s, early 50s, and they don't qualify for insurance. They're not able to work anymore because they're taking care of their grandchildren, or they are too disabled but not disabled enough, and so they don't receive those subsidies.
One of our participants applied for indigent care because she needed some diagnostic tests done, and they told her that even with making minimum wage at 20 hours a week, she was not eligible. There are people out there making an effort that are really out there trying to do what they need to do, and those are the ones that are falling through the cracks.
Many people who are unable to access medical care first end up receiving their medical care in the hospital setting unnecessarily. They go through the emergency room, have advanced issues with their health care, that needlessly advanced issues that could have been taken care of outside of the hospital. There's no question about it in my mind what the benefits that could be derived from receiving health care at an earlier point.
They don't take their medications. They don't see doctors when they need to, and it ends up being pretty difficult for them later on. They go to the emergency room if it's really bad, or they just don't go anywhere.
I didn't want to go to the emergency room, and the reason being was because I knew I didn't have any health care. And then your health deteriorates because you're not in the right place, or you are struggling in other areas of your life. Yeah.
I could get back on my depression medicines, I could get back on my anxiety medicines, I could get back into counseling, and hopefully would stop ending up in hospitals.
It would mean a lot, because like I say, it would take a lot of challenging thoughts off my mind and stress and things of that nature.
It would actually help people that are not able financially to carry insurance to get help.
Well, I think in the case of my clients, it would probably save some lives.
It would keep me on focus, keep me on track to be so productive, and also to help others as well.
I think if everyone had some form of health insurance, if that was an option to everyone, it would impact the whole family.
They need to turn up the sensitivity a little bit. Come from behind the walls, get out here and see what we're going through.
There's a lot of people are suffering because of no insurance. I mean, really suffering.
Because like I say, life is a gift from God, the most important thing, and I think everyone is entitled to have health care, whether they are whatever level of life they're on.